Have you ever felt an unusual change in your body? A strange sensation that is difficult to describe, making you wonder if something serious is happening. Sometimes, seemingly minor signs can be important warnings from your body about a dangerous health condition. We often ignore these signals, assuming they are just temporary effects of fatigue or stress. However, doctors always remain cautious about certain symptoms because they can indicate a serious underlying issue or even be signs that life is at risk. Today's video will explore 6 crucial warning signs that medical experts believe could signal a severe health problem. These symptoms may initially seem insignificant and are easy to overlook, but if you or a loved one experience them, do not take them lightly. Your body might send out a distress signal you cannot afford to ignore. Have you ever felt a sudden, unexplained exhaustion, even after adequate rest? Or sharp, deep chest pain that appears without any injury? These are not just ordinary inconveniences. They could be signs of cardiovascular issues or other serious medical conditions. Other symptoms, such as unusual changes in breathing, unexplained weight loss, or cognitive and memory disturbances, can also serve as critical warning signs. Stay tuned until the end of the video to better understand these warning signs and why they should never be ignored. Recognizing them early and taking timely action can help you manage your health before it is too late. Don't let negligence put you or your loved ones at risk of serious consequences. Let's begin exploring these important warning signs you need to know. 1. Shortness of breath or rapid breathing. A dangerous warning sign. Imagine sitting still, relaxing in a chair without any strenuous activity, yet suddenly feeling as if the air around you has been drained. Each breath becomes heavy and difficult. No matter how hard you try, you just can't get enough oxygen into your lungs. This isn't just a fleeting discomfort. It could be a warning sign of a serious underlying issue within your body. Sudden or persistent shortness of breath is a symptom that doctors always take seriously because it can be linked to life-threatening conditions such as heart failure, pulmonary embolism, a blood clot blocking the arteries in the lungs, or even a silent heart attack, one that occurs without the typical chest pain symptoms. In some cases, this condition may also be triggered by a severe allergic reaction, a serious lung infection, or chronic obstructive pulmonary disease, COPD. If you experience unexplained shortness of breath, never ignore it. When this sensation comes on suddenly or worsens over time, you should first stop any activity, sit down, and try to stay calm. Panic can worsen things, so focus on taking slow, deep breaths. If your shortness of breath is accompanied by chest pain, dizziness, and pale or bluish skin, do not hesitate to call emergency services immediately. Delaying medical attention can have severe consequences, especially if the cause is heart-related or due to a pulmonary embolism. Additionally, paying attention to accompanying symptoms is crucial. If shortness of breath is paired with leg swelling, it may indicate heart failure. If you are coughing up blood, a serious lung condition, such as a pulmonary embolism, could be the cause. A lung infection might be the main culprit in cases of high fever. These details will help medical professionals diagnose and treat you more effectively. Shortness of breath is not always an immediate emergency, but it should never be taken lightly when it occurs abnormally or persists. Listening to your body and acting promptly could save your life. Sometimes just a moment of hesitation can mean the difference between safety and danger. 2. Confusion, disorientation, or sudden personality changes. A critical warning sign. Imagine conversing with someone you know well, but suddenly they seem confused, forgetting simple things, or even failing to recognize you. They may speak incoherently, become agitated, or display unusual behaviors that were never present before. Sudden changes in memory, cognition, or personality are abnormal and should never be ignored. These could be signs of a serious health issue requiring immediate intervention. One of the most common causes of these symptoms is a stroke. When blood flow to the brain is disrupted, Brain cells can become damaged within minutes, leading to confusion, disorientation, slurred speech, loss of recognition, or even temporary unconsciousness. Without prompt treatment, the consequences can be severe, potentially resulting in permanent disability or even death. Beyond strokes, severe infections can also impact brain function, particularly in older adults. Conditions such as meningitis, sepsis, or serious urinary tract infections can cause individuals to become drowsy, disoriented, or even fall into a coma if left untreated. Another possible cause of these symptoms is neurodegenerative diseases such as dementia or Alzheimer's disease. While these conditions typically progress gradually, there are cases where individuals experience sudden cognitive decline. This can lead to confusion, anxiety, and even drastic behavioral changes, making them irritable or causing unexpected reactions that were never seen before. If you notice someone suddenly becoming disoriented, mentally foggy, losing their sense of direction, or exhibiting significant behavioral changes, do not hesitate. The most important step is to seek immediate medical attention to properly examine and diagnose them. If a stroke is suspected, look for additional warning signs such as facial drooping, slurred speech, or weakness on one side of the body. In such cases, time is critical. Getting the person to a hospital within the golden hour can save their life and minimize long-term damage. If an infection is the underlying cause, early treatment can help control the illness and prevent further complications. For individuals showing signs of cognitive decline, early detection allows for appropriate care planning and may slow down the progression of the disease. Confusion, disorientation, or sudden personality shifts are not merely signs of fatigue or stress. They can serve as urgent warnings of serious health conditions. Always stay attentive to these symptoms and act quickly to safeguard yourself and those around you. 3. Sudden, unexplained weight loss. A warning sign that your body is in danger. Have you noticed that your clothes are becoming looser without changing your diet or exercise routine? Is your weight dropping rapidly without any effort? Don't be too quick to celebrate if you're losing weight unintentionally. This could be a warning sign of a serious health issue your body silently alerts you to. Sudden weight loss, especially when you lose more than 5% of your body weight within a short period. For example, a 70-kilogram person losing more than 3.5 kilograms without a clear reason could indicate that your body is struggling with an underlying illness. One of the most concerning causes of unexplained weight loss is cancer, particularly pancreatic, lung, or gastrointestinal cancers. When the body is affected by cancer, it can accelerate metabolism, breaking down muscle and fat, even if you haven't changed your diet. Cancer cells can also disrupt the body's energy usage, leading to uncontrolled weight loss. Additionally, serious heart conditions can also be a culprit. When the heart struggles to pump blood efficiently, the body works harder to sustain vital functions, causing higher energy consumption than usual. People with heart failure or other cardiovascular diseases often experience fatigue, loss of appetite, and gradual weight loss without realizing it. In addition, metabolic disorders or undiagnosed diabetes can also be potential causes. When blood sugar levels become unregulated, the body may struggle to use glucose efficiently, leading to energy depletion and fat and muscle tissue breakdown as compensation. This is why many individuals with type 1 or early-stage type 2 diabetes often experience unexplained weight loss before receiving a diagnosis. If you notice significant weight loss without changing your diet or physical activity, do not ignore it. The most important step is to seek medical attention immediately, especially if weight loss is accompanied by persistent fatigue, loss of appetite, unexplained abdominal pain, or changes in bowel habits. Blood tests, X-rays, or other advanced medical examinations can help detect underlying health issues early, allowing for timely treatment. Many conditions can be effectively managed or treated when caught early, rather than when they have already progressed to a more severe stage. Sudden weight loss is not always a sign of a serious illness, but treat it as an important warning signal if it occurs without a clear reason. Listen to your body, act early, and never underestimate unexplained changes, because your health is your most valuable asset. 4. Sudden and intense chest pain. A warning sign you cannot ignore. Imagine going about your day, working or relaxing as usual, when suddenly a crushing pain strikes your chest, like a heavy weight pressing down, making it hard to breathe. The pain may radiate to your arm, neck, jaw, or back, leaving you in distress, unsure of what's happening. At that moment, you might dismiss it as muscle pain or heartburn. Still, in reality, it could be an impending heart attack or even a ruptured aortic aneurysm, one of the most life-threatening medical emergencies that can take mere seconds to become fatal. Many people make the mistake of underestimating chest pain, trying to endure it, believing it will pass on its own. However, doctors are highly cautious about this symptom because even a slight delay in seeking medical help can mean the difference between life and death. A heart attack is not always present as it is in movies, where someone suddenly clutches their chest and collapses. The symptoms can be subtle and easily mistaken for other conditions. Some individuals only experience mild discomfort, while others feel as if they have been struck hard in the chest with unbearable pressure. The pain can start mild and gradually worsen, or appear suddenly and without warning. In addition to chest pain, other associated symptoms may include shortness of breath, nausea, dizziness, cold sweats, and weakness or lightheadedness. Notably, in women, the elderly, and diabetic patients, a heart attack may not present with obvious chest pain, but rather with unusual fatigue, a feeling of fullness or mild discomfort in the back or jaw. Not all chest pain is caused by a heart attack. If the pain is extremely sharp and severe, feeling like your chest is being torn apart from the inside, it may be a sign of aortic dissection. In this life-threatening condition, a tear in the aorta allows blood to seep between the layers of the arterial wall, weakening it rapidly. Within minutes or hours, this can lead to aortic rupture, causing massive internal bleeding and death if emergency surgery is not performed in time. If you or someone around you experiences sudden chest pain, do not wait and do not assume it's just stress or indigestion. The most critical action is to call emergency services immediately. While waiting for help to arrive, try to stay calm and avoid lying down, as this can cause sudden blood pressure changes that may worsen the situation. Time is a critical factor in these cases. The sooner medical intervention occurs, the higher the chances of survival. If it's a heart attack, doctors can administer clot-dissolving medications or perform angioplasty to restore blood flow to the heart. If it's an aortic dissection, emergency surgery is the only life-saving option. Chest pain can have various causes, but if it's sudden, severe, or accompanied by unusual symptoms, never take it lightly. Your body may send you an urgent warning. Listening and acting quickly could save your life. 5. Extreme fatigue. Without a clear cause. When your body is crying for help. Everyone experiences fatigue after a long day at work or a poor night's sleep. But if you find yourself persistently exhausted, feeling completely drained, even after a full night of deep sleep, or if simple daily activities suddenly feel like overwhelming challenges, this is no longer just ordinary tiredness. It could be a warning sign that your body is struggling with an underlying health condition. This extreme exhaustion cannot be fixed with a cup of coffee, a short nap, or a few days of rest. It lingers, weighing down your body without any clear explanation. Perhaps you used to easily go for morning walks, but now, just a few steps leave you breathless and weak. Tasks as simple as preparing a meal, getting dressed, or even having a conversation may feel like too much effort, as if your body is running out of energy. Many people mistake this persistent fatigue for natural aging or stress, but it can be a sign of organ dysfunction, heart failure, endocrine disorders, or even late-stage cancer. When the heart weakens, it struggles to pump enough blood and oxygen to the body, leading to rapid exhaustion. Conditions such as hypothyroidism, metabolic disorders, or severe anemia can also leave you feeling completely drained, even when you're not exerting yourself. One of the most concerning signs is when this fatigue appears suddenly, without any clear reason, or gradually worsens over time. If you were once full of energy, but now feel weak and drained for no apparent reason, it's time to pay attention and take action. The most important thing is not to ignore or dismiss this symptom. Start by listening to your body and monitoring the fatigue closely. Ask yourself, how long has this been going on? Did it appear suddenly, or has it been getting worse? Are there any factors that make it worse? Is it affecting my daily life? If persistent fatigue significantly impacts your quality of life, do not delay seeking medical attention. Many serious conditions can be treated more effectively if diagnosed early. A doctor can conduct necessary tests to determine the root cause and recommend the appropriate treatment before the condition worsens. Do not let complacency make you overlook important signals from your body. If this unusual fatigue feels different from normal tiredness, listen to it. Taking timely action can help protect your health and even save your life. 6. Severe and prolonged abdominal pain. When your body sends a critical warning. Sometimes, abdominal pain is a temporary reaction to unsuitable food or stress. However, suppose the pain is sudden, sharp, or persistent, without signs of improvement. In that case, it is no longer just an ordinary stomachache. It could be a symptom of a serious medical condition that requires urgent intervention. You may feel a piercing, stabbing pain, or a dull ache that progressively worsens. The pain might even radiate to your back or chest, causing severe discomfort. In many cases, if the pain does not subside and instead intensifies, your body could be signaling a medical emergency. One of the most dangerous causes of severe abdominal pain is a ruptured abdominal aortic aneurysm, AAAA. This occurs when the wall of the aorta in the abdominal region weakens and expands over time. When the artery ruptures, blood spills into the abdominal cavity, causing sudden, intense pain that can lead to shock and a rapid drop in blood pressure. Without immediate surgery, the condition is often fatal. Additionally, severe and prolonged abdominal pain may be a sign of a serious bowel obstruction. When the intestines become blocked due to a tumor, adhesions, or twisting of the bowel, food and digestive fluids cannot pass through, leading to excruciating pain, bloating, vomiting, and an inability to pass stool. Without timely treatment, this can result in intestinal necrosis and life-threatening infections. Another critical condition to consider is acute pancreatitis, a severe inflammation of the pancreas. This condition causes excruciating, cramping pain in the upper abdomen, often radiating to the back. The pain worsens after eating, especially after consuming fatty foods. Other symptoms include nausea, vomiting, high fever, and rapid heart rate. If left untreated, acute pancreatitis can lead to organ failure or sepsis, both of which are extremely dangerous. If you experience severe, prolonged, or worsening abdominal pain, do not ignore it or try to endure it. Seek immediate medical attention, especially if the pain is accompanied by high fever, persistent vomiting, a hard or swollen abdomen, pale or clammy skin, signs of low blood pressure, such as dizziness or cold sweats. Ignoring these symptoms can be life-threatening. Listen to your body's warning signals and take action promptly. Getting medical help in time could save your life. Dangerous abdominal pain does not always appear as an immediate, obvious emergency. However, if the pain disappears or worsens over time, your body sends an urgent warning. Early detection and timely action can differentiate between controlling a condition or facing serious health risks. That's why persistent abdominal pain should never be ignored. Your vigilance could save your own life or that of a loved one. Always pay attention to your body's signals, as they could be early warnings of an underlying health issue. Do not overlook unusual symptoms, whether prolonged fatigue, mild discomfort, or subtle changes in your daily routine. Sometimes, what seems harmless initially may be the first sign of a serious illness. Taking proactive steps to monitor your health, listening to your body, and acting promptly can make a crucial difference between early disease detection and facing severe consequences. Do not hesitate to seek medical advice immediately if you notice any persistent or worsening symptoms with no clear cause. A timely decision can not only protect you, but also save the lives of your loved ones. Health is the most valuable asset, and being proactive today can be the key to living a longer, healthier, and more fulfilling life.